it is extremely common for adults over the age of 50 to be concerned about a decline in their cognitive abilities. Some studies have suggested that upwards of 80% of such individuals have these kinds of concerns. It's predictable that certain kinds of things will change as we get older. These kinds of things include speed of processing, the ability to do more than one mental task at a time, the ability to rapidly retrieve information or to problem solve. There is relative preservation of certain kinds of mental activities like verbal skills or our knowledge of general information or ability to recognize various kinds of things that we have remembered. Now, it's really common for people to have difficulty rapidly retrieving someone's name as they get older. For example, when they might see a face, a celebrity, or an acquaintance. However, it's concerning if a person can't actually recognize the face as someone he or she knew or had met in the past. It's also really common for people to have occasional problems finding words, but much more concerning if a person exhibits very frequent word-finding pauses or substitution of words. What's important to know is that normal cognitive aging allows a person to remain independent and socially active. It becomes really much more concerning as people get older if they become increasingly dependent on others to manage their daily living activities. Well, people want to know what they can do to promote their own cognitive well-being or health as they get older. It's important to know that there are lots of activities under our personal control that may help support or promote healthy cognitive aging. For now, I'll highlight two for which there's a lot of converging supportive evidence: participation in intellectually stimulating activities and in vigorous physical activity. There are epidemiological studies that follow individuals over many, many years, if not decades, that have shown that adults who are engaged in intellectually stimulating activities and a variety of hobbies have a lower risk of developing dementia as they grow older. The bottom line is that there is strong and exciting evidence that aging brains are capable of changing and of plasticity. And there are intervention studies where people are randomized to aerobic exercise or not, and those who participate in aerobic exercise demonstrate a growth in the size of the hippocampus, this memory area in the brain, and improvement on cognitive test performance. So the bottom line is that there's growing evidence that staying physically, cognitively, and socially active, eating a heart-healthy Mediterranean-style diet that emphasizes fruits and vegetables and fishes and limits intake of meat, being aware of and treating things like hypertension and diabetes, avoiding things that can injure our brains like head trauma or toxic substances, can all come together to promote healthy brain aging and plasticity. There is a lot of exciting research being done at the Brigham Women's Hospital trying to advance this field. Our lab is actively investigating factors that promote healthy cognitive aging in older folks. Our study, entitled SAGE, or Successful Aging and Enrichment, this is the first study to try to carry out a head-to-head comparison of the effect of different types of structured physical or mental stimulation over a 5-week training period. So basically, participants are being randomly assigned to either a physical exercise program, a computerized cognitive stimulation program, or mindfulness attentional training program, all of which take place in the homes of each of the participants. This study should be able to provide some vital information about the most effective ways that older individuals can improve cognitive health given the limited time we all have. It should also help elucidate mechanisms that underlie changes in cognitive performance. There are other exciting studies at the Brigham and Women's Hospital that are focused on early detection and treatment of cognitive decline. So, for example, a colleague of mine, Dr. Risa Sperling, is the principal investigator of a trial called the Anti-Amyloid Treatment in Asymptomatic Alzheimer's Study, which is a mouthful. It's fondly known as the A4 trial, which aims at treating underlying Alzheimer's disease before symptoms develop. It is the first study of its kind, and people are very excited about moving forward with it. Patients who have Alzheimer's disease and related disorders are facing really complex and devastating conditions that often impact on every aspect of a person's life. It's our view that optimal care requires an integrated team approach that involves experts as cognitive neurologists, as neuropsychiatrists, neuropsychologists, and social workers. The first meeting that a person has with our group is with a physician who takes time to really gather a detailed medical history from the patient. We strongly encourage patients to bring family members in who can provide additional perspective and support. People can expect a series of assessments that will be carried out to better understand a person's predicament. The major goal really is to find the pattern of deficits that can identify the underlying neurological condition. We aim to systematically narrow the list of possibilities in order to reach a definitive diagnosis. Members of our group also are part of what's known as the Center for Alzheimer's Disease Research and Treatment that aims to provide patients at all stages of the illness with experimental medications that hopefully may change the course of the illness and affect the underlying disease process. At the same time, we have close ties with members of the Center for Neurological Diseases under the direction of Dennis Selko, who are working at the forefront and the cutting edge of understanding the underlying biology of these diseases. The groups of clinical care, translational research, and basic care work together to try to provide patients with the most up-to-date, cutting-edge treatment strategies, and that can provide them really with an opportunity to have access to what's most recently learned about the illness and what might prove to be most helpful.